Hi there, everybody. I'm Dr. Macy Smith, and you're listening to Health and Wellness Wednesday on the People Station, where we connect you to community resources through awareness and opportunities. Today, we are concluding a series of conversations we've been having with staff over at the Orangeburg Senior Helping Center, what I consider a gem in Orangeburg, South Carolina, but they do service Orangeburg County, Calhoun County, and Bamberg County. Y'all have been hearing me talk about the medical director over at the Orangeburg Senior Helping Center, and we are so blessed to have her here with us today as we continue our conversation about the Orangeburg Senior Helping Center, a PACE healthcare program. Welcome to this show, Dr. Cherie Goodman. Hey, Dr. Goodman.
Hello.
You know I have been trying to get you over here for several weeks now, and you acquiesced. I tell you, the services that you provide is absolutely so meaningful to so many seniors in our counties. Now, what type of reception have you been receiving since being at the Orangeburg Senior Helping Center?
Very warm reception. The participants, the families, they've all been very appreciative of my care and the services that we as a medical clinic at the Orangeburg Senior Helping Center provides to them.
Well, tell our listeners a little bit more about who you are, Dr. Goodman.
Well, I am an internal medicine doctor, trained at the Medical University of South Carolina, and did my residency there as well. I practiced for several years in Charleston and recently transitioned over to the Orangeburg area.
Well, we are so happy to have you. I do know that with PACE, Program of All-Inclusive Care for the Elderly, is a health care program. So the services that you provide at the center, are they specialty care, or can someone come to you if they're having a headache or having some level of pain?
Well, essentially, I am a primary care provider. I function like a family doctor or an internist. I'm trained as an internist. So you come to me with everything and anything that is beyond my scope of practice, something that does require specialty care, like a cardiologist or a cancer specialist or a breast specialist. I make the appropriate referrals to those people.
Okay, that's important to note. Let's put a pin in it. We'll be right back, and when we come back, we're going to talk about those specialty appointments that our individuals need. We'll be right back. Welcome back. I'm Dr. Macy Smith, and I am here chatting with Dr. Cherie Goodman, Medical Director at the Orangeburg Senior Helping Center, a PACE healthcare program. Now, Dr. Goodman, before we went to break, you did mention that you do see the participants who attend the Orangeburg Senior Helping Center. You provide primary care, but if there is a need for a specialty visit, such as maybe a urologist or an oncologist, you tend to make those referrals too. Tell us a little bit about how that works.
Well, just the same way that it would work in a normal primary care practice. If you come in with something that is beyond a primary care level problem, for instance, you've got a urologic issue, a gentleman that we diagnose, say, with an elevated PSA or a prostate problem.
Okay.
That's the prostatic specific antigen, and that's one of the screening tests that we do in men over 40. But if we find a problem, then I would make the appropriate referral to a urologist, which is the specialist that would evaluate that a little bit more closely.
Okay, now that's perfect, because we always talk about how individuals who are participants, they do receive medical attention, but in addition to that, Dr. Goodman, the transportation to those medical appointments is so key, especially when we think about our rural areas and having access. Now, does the Orangeburg Senior Helping Center also provide transportation for those specialty appointments that you make referrals to?
We provide transportation for everything. We will pick patients up in the morning and take them home in the evening for day center attendance, as well as all appointments. So a lot of times family members, have crazy schedules, and it's hard for them to take off to take their family member to these appointments. So we will take them to the appointment, as well as they have someone who is with them, who sits with the patient and can bring information back to the clinic, as well as the family member.
And so that's so important too, because you are the primary care physician, and I always talk to my patients and my families about ensuring that they have a primary care doctor to funnel all the specialty appointments, so that way you can make decisions in terms of treatment and care. When we come back, I want to talk a little bit about your role being an African American female in a predominantly African American community and in counties when we're talking about healthcare disparities. We'll be right back. Welcome back. You're listening to Health and Wellness Wednesday on the People Station. I'm your host. I'm Dr. Macy Smith, and we're still here chatting with Dr. Cherie Goodman. She is the medical director over at the Orangeburg Senior Health Center. Now, Dr. Goodman, before we went to break, I wanted to jump into your role a little bit more on a personal level at the PACE program. As the medical director, you are an African American female, and I know you know the data. The data supports that when African Americans go into the doctor's office, if their doctor does not look like them, we tend to see that they may not follow through or follow up on the recommendations. There have also been cases where doctors have misdiagnosed or not diagnosed individuals at all with medical conditions that could have been addressed, but because they weren't, they led to comorbid conditions. And I'll give you an example. I read an article not that long ago. This young lady, she has Alzheimer's disease, and because she couldn't communicate her needs well, she communicated more so with behaviors and sounds and just agitation. And the doctor said, well, it's the Alzheimer's. You know, it's nothing more. And so the daughter knew enough to actually seek further tests and further information about what it could be, and she had like blood clots in her stomach. Do you understand your role and what you actually mean to us here in Orangeburg County, Bamberg County, and Calhoun County? And what have been some success stories you can share with us?
I do understand my role. I come from a family background where there was a lot of medical issues, and what would happen, my family members would go to the doctor and come back and not be able to tell me, one, what the problem was, or two, what treatment was prescribed for them, because it was put to them in a way that they could not understand and communicate it to me.
Health literacy.
Yes.
Right.
So from the beginning, I've always tried to practice with a sort of culturally competent care, knowing the people that I'm serving, knowing our lifestyle, knowing the way we communicate and say things and how we receive things. So I make sure that when I am getting a history, I ask not only the patient, because in our population we do have a lot of people with cognitive deficiencies or early dementia. I also talk to families to make sure that I'm getting the information from the people who are watching them closely and can give me a little bit more information. And that guides me a lot better than trying to take the grunts or the sounds of someone with Alzheimer's or dementia. And then also knowing when somebody tells me, you know, it's, I think it's the food we're eating, knowing exactly that they're talking about, you know, the pork meat.
Right, how salt, how fat, the
that they had on
ham
Sunday that might be driving their blood pressure up. So I do carry that and try to make sure that I am providing that culturally competent care.
Well, I can speak for everyone there and countywide. We thank you, we appreciate you, and I want you to provide our listeners with a contact number at the Orangeburg Senior Health Center, so that way they can make a contact and see if their loved one qualifies for the services, because you are real. You are real.
I am real.
How can they get in contact with the center?
Our number at the center is 803-268-5300. That will put you in contact with our front desk. They can direct your call to whoever you need to speak with. If you're interested in care, to be one of our marketing folks.
Thank you so much. It's Dr. Cherie Goodman. You're listening to Health and Wellness Wednesday on the People Station. If you have a product or service or an event that's coming up and you want it highlighted on the show, give us a call here at 93.7 FM, the People Station. See you next time.